Welcome to the Justice Journal podcast. I'm Sacramento County District Attorney Anne Marie Schubert. I hope you enjoy this podcast series where we discuss important public safety issues and provide insight into who we are as an office and what we do both in the courtroom and in the community to provide the highest level of public safety through prosecution, prevention, and innovation.
Thank you for joining us for part 2 of the Youth Vaping podcast series. We are extremely fortunate to be joined by Kaiser Permanente medical representatives to continue our discussion on the serious health and safety issue of vaping, especially among our youth. We have with us Dr. Virginia Barrow, who is an assistant chief of pediatrics, and Dr. Clarisse Glen, who is in pulmonary medicine. Dr. Barrow and Dr. Glen, can you please tell us about your professional backgrounds and current roles?
So I've been at Kaiser Permanente for 9 years. I've been in practice for 20 years. I was in Chicago for 8 years and then at UCLA for 3 before settling here. In addition to working in primary pediatrics, I also have a background in medical education. So I enjoy helping physicians learn more about new things by helping to coordinate continuing medical education opportunities.
Great.
I am a board-certified pulmonary critical care and sleep physician. I joined Kaiser 2 years ago. Before that, I was working in Boston for 3 years, so I've been in practice for about 5. So I do an equal amount of pulmonary medicine, critical care medicine, sleep medicine, and have had some exposure to the current illness, which we'll be talking about.
Great. Well, welcome. Thank you so much. So I'm going to dive right into the medical aspect of, can you explain how vaping differs from traditional smoking? When I say that, I mean, how does a body accept it, process it, and how does it, how and why is it more potent, say, than traditional smoking, if it is?
Mm-hmm. So the main differences between vaping e-cigarettes and smoking traditional e-cigarettes is the method in which the nicotine is delivered to the body, as well as the number of chemicals contained in an e-cigarette versus a traditional cigarette. So an e-cigarette is a battery-operated device that uses a heating element to heat a liquid containing nicotine, flavorants, and other chemicals, heats it into an aerosol, which is then inhaled by the body. A traditional cigarette is composed of 600 ingredients and is burned to produce a smoke. That smoke then releases around 7,000 chemicals, many of which are known to be carcinogenic. Initially, when e-cigarettes first came out onto the market, they were marketed as safer than traditional cigarettes because they contain fewer chemicals. That's since been debunked. But the way the body processes vaped nicotine versus inhaled nicotine is actually quite similar. They're both rapidly absorbed into the bloodstream and then reach the brain very quickly in about 10 seconds. So actually the way nicotine gets to the body and the brain is similar. It's just the method in which it's inhaled.
And this question is for both of you. When you first heard about vaping and whatever was known initially, we all know how it was marketed and advertised. Did you have immediate concerns? Were you skeptical?
Definitely. Nicotine is nicotine. It's an addictive substance. And just because it was smoked or rather inhaled in a different manner, I still was concerned about its long-term effects.
We know that nicotine is a neurotoxin, and in particular, the developing brain is very vulnerable to neurotoxins. We learned in the 60s that smoking when pregnant was dangerous for the developing brain of the fetus. But we're learning more and more about how the brain develops in adolescence. Our brains aren't fully developed until we're in our early 20s. And some aspects of brain development that happen in adolescence have to do with regulation, excitation neurons, and inhibitory neurons. And they develop at different rates in girls and in different rates in boys. And just as boys develop later physically, their brains develop later. It's very interesting.
Yeah.
And what we find with the neurotoxin is that it it may be affecting parts of your brain that are important for learning, for memory, and for self-control. And so it's a grave concern how this will influence these kids and how they behave and learn, and how they function as adults. And we also know that children are much more vulnerable to becoming addicted to nicotine. Nicotine on the developing brain is much more likely to result in the outcome of addiction than nicotine on a fully developed brain. So the likelihood of a long-term dependence that's difficult to break is much greater the younger you are when you begin your exposure.
So vaping laws is basically now falls under the tobacco laws. And the law changed to where the legal age went from 18 to 21. Unless you're active military, then you can at 18. But at 21, it still sounds like it could impact the brain because it's still developing at that point.
That's absolutely true.
Right. So even at age 21, it's really not safe. Mm-hmm. What is currently known about vaping medical risks and its impact on health? I mean, we've heard a lot in the news, but in the medical community, is there a medical explanation for what's known? I know there's a lot that's not known yet.
So we've seen a sudden uptick in vaping-associated respiratory illnesses in the past few months, 1,479 to be exact. Many of these cases were severe lung injury, 33 of which led to death, not in our community, but nationally.
Right.
And these took place or occurred in otherwise young, healthy patients. So it's still unknown exactly what's caused the severity of illness that we've seen. Active infection doesn't seem to play a role. It's suspected by public health officials that mixing of multiple ingredients along with the primary compounds may have produced some toxic agent that we're unsure of, some type of toxic byproduct, likely because there was some contaminant in either the e-cigarette fluid or the device itself. So further investigations still need to be conducted. The addition of THC or CBD oil into the mix is something that also needs to be investigated.
So as of right now, there's no, I mean, I imagine they're trying to look for each case that's similar enough to where they can pinpoint, okay, this is a consistent among all these different cases. But as of right now, they're not finding anything where they're pinpointing, okay, this is a common denominator, so we're going to pick this.
So actually 80% of these cases involved vaping THC oil. So there is that common denominator. But what we don't know is whether it's THC in addition to whatever was contained in the e-cigarette fluid or the e-cigarette device itself, or whether there was some agent mixed in with the THC that could have been the culprit.
So as of right now, though, THC seems to be, 80% wise anyway, a pretty consistent factor.
Yes.
Okay. Did you have anything to add?
So labeling of these products is not standardized. And in fact, when they have done some analysis of the different products, they often find that they contain something different from what they say they contain. When you're dealing with a product that's not regulated, not only can that product not be what it says it is, it may not even be from the last time you bought it, the same thing that it was the next time that you buy it.
And that's if people buy it from a retail. This is not talking about people getting it from someone who knows someone.
I'm so glad you brought that up because for children, they are especially vulnerable. A normal developmental task of adolescence is that you begin to seek out your own role models and your own sources of information. And so kids don't go to the traditional adult, their parent, or someone like that to look for information, and that's normal. But what's dangerous is that they are purchasing things that they really don't know what it is, and they may trust when they shouldn't trust. The product, it may have been adulterated. There are definitely cases of the cartridges have been refilled by, someone is making something at home. So, and kids are curious. Kids are exploring. There are all these different technologies. They take them apart. They got a soldering iron for Christmas, and they're exploring, how does this work? What can I do with this? What can I make that's like this? And we just don't know what they're using. They're just curious and smart and creative and at risk.
Is Kaiser, and even the medical community outside Kaiser, is this kind of information being shared?
There are some great resources for this kind of information. Whether you're someone who has the good fortune of working within the Kaiser system or not, certainly there's information you can get from the CDC as well as from the American Academy of Pediatrics. Those are great resources for true information, vetted information about what is the standard of care, and how to help kids when they come to you because they're concerned that they're addicted or they're having symptoms when they use it, or because they are using it and they don't know what it is going to do to their bodies. And so those can be resources. But also within the Kaiser system, we have a wonderful program of health educators. The health educators have an important role in providing services to facilitate what physicians are doing. They also go into the schools and they provide education to teachers and administrators about what to look for.
So they educate Kaiser medical professionals, but they also go out into the public and educate them as well.
Yes, they do. It's been a wonderful resource for helping the schools. The schools often have a resource officer who can help identify when things are happening in the school. And if the teachers and the parents all know what they're looking for, then we can identify these kids early and get them the help they need. For patients, there's also individual counseling. There is treatment for addiction. Kaiser has long been an industry leader in helping people who want to stop smoking, and this is really no different from that. One thing that really disturbs me about the marketing around e-cigarettes is that there's been some false information that e-cigarettes are part of helping people stop smoking. And from what we know from studying that so far, e-cigarettes are harder to stop than regular smoking. They are not a means to quit smoking, and there are well-studied ways that we can help people stop smoking. We've got the resources for that. We've got that dialed in, and we really want to help our patients who need that to get into some gold standard proven methods for helping them to be healthier.
How does Kaiser go about, does a minor, because they're not going to tell their parents most likely. So how can they reach out for that kind of help? Can they talk to their physician directly? How can they access that without having to go to their parents? Because I just don't see that situation happening very often.
You might be surprised to know that when adolescents come to the doctor, they usually see the doctor with their parent, but they also see the doctor with privacy. And teenagers are welcome to have privacy when they're seeking care, especially for certain kinds of problems. And among those are drugs and alcohol, depression and anxiety, questions about contraception. And we invite every patient to include their parent in those discussions, but we also always let them know that if they need to have a conversation with someone with privacy that they can trust, as long as they're not telling us they're suicidal, at risk of harming themselves, we're going to protect their confidence and make sure that they get true information and the help that they need to protect their health.
Would the parents then be folded in at that point if a minor or a youth were to say, I think, I'm vaping or whatever it might be, and I think I might need some counseling? Can they access that on their own, or would the parents or the guardians be involved at that point?
They're always encouraged to include their parents in their care, but there are some kids that need to do that with privacy, and they are able to access that kind of care without their parents. It's so important to lay the groundwork before they start.
Yes.
And the great thing about having a pediatrician who's been with you since you were little is that they've been laying the groundwork, giving you information that you could trust since you were really little. And they've been letting you know that a day may come when you want to talk to me by yourself, and that's okay. I'm going to always be in your corner. And my number one thing is to keep you healthy. And if we've laid that groundwork and had that relationship in a long-term way like we hope to, then when they need us for this or for something else, they know and their parents know that they can count on us to do that.
We know the impact short term, relatively. What are your concerns about the long-term health risks?
That's a great question, but also a challenging one. E-cigarettes are still a relatively new product. I think they've only been sold in the US for about a decade. So we don't have the longitudinal studies available like we do in traditional smoking to know what would happen 10, 20, 30 years down the road. I think it's fair to speculate that the same types of effects that nicotine causes on the body in traditional smoking would also occur in vaping. We know that smoking nicotine increases the risk of cardiac disease. So I believe that vaping nicotine would cause the same. What's interesting, though, is that the e-cigarette devices, the coils that are used to heat up the liquid containing the nicotine, they're made of metals, nickel, lead, chromium. And studies have shown, new studies actually, have shown that the concentration of these metals in the aerosols that are produced by heating the liquid are quite high.
So they're inhaling the metals?
They are inhaling metallic fumes. And we have enough data over the past several decades to know that inhaling metal fumes, metallic dusts, can lead to a whole slew of lung problems, COPD, lung fibrosis, cancer. So if a child or an adolescent, say, is starting to inhale metallic dust at this age, imagine what their lungs are going to look like in 30 years.
So
It's
the
scary.
device itself, let alone, forget about the substance part, but the device itself is contributing to the medical impact.
The device itself is toxic.
Wow.
And it'll depend, too, on the number of metal parts. The more metal parts in the e-cigarette device, the more they're going to get exposed. But also, it's directly correlated to the voltage and the power of the device. So there are some e-cigarette devices that are high voltage, high power. The higher the voltage, the higher the concentration in the aerosol. And I don't know if this is something that people who are vaping are even aware of.
I don't think so.
Yeah. This is brand new data.
I'm learning all
Yeah.
about this subject recently, but
Yeah.
I've never heard that. Is it known whether vaping is more addictive, less addictive, maybe the same in terms of nicotine and other substances than traditional smoking?
Well, a little too new, however, assuming equal concentrations of nicotine in an e-cigarette versus a traditional cigarette, the addictive potential is similar.
Okay.
But we're learning that this is not the case. You can buy nicotine cartridges or e-liquid nicotine cartridges in extra strength. So they come in much higher concentrations. So if you are, some people actually are smoking 2 cartridges a day containing 60 milligrams of nicotine each. A traditional cigarette has 9 milligrams of nicotine. A lot of that nicotine actually dissolves once it's smoked or burned, rather. So they're smoking higher concentrations of nicotine. They're inhaling higher concentrations of nicotine when vaping than they are with traditional smoking. So yes, it's much more addictive because it's more potent.
And more damaging?
More
More
damaging.
nicotine, the more damaging?
Yes, absolutely.
There's also when a person smokes a cigarette, they hold it and they talk to their friend, they take a puff. So if you're looking at how much nicotine is in a cigarette, a lot of that nicotine actually never goes in your body.
Because it burns away?
Holding it, and it goes off into the air. But this vaping device is activated when you breathe in. So none of that nicotine goes anywhere but in your body. You're using it really efficiently, which is different from regular smoking. The other thing is, when you smoke a cigarette, generally a person would go outside. They would have a time when they're doing it. smoking is not so common anymore, but people who smoke go outside and take a smoke break.
It's inconvenient, basically, yes.
Yes. Kids vaping, they've got this thing inside their sweatshirt. They're doing it all day. And so not only is it the case that the device doesn't waste any of the nicotine into the air, it all goes into your body, but also it's convenient in a way that allows them to do it all the time. Plus, it tastes and smells like candy, not like, your hair doesn't smell like ash after. And, if you're an adolescent, smelling bad might be a deterrent, but smelling like candy might actually be something that encourages you to do it. So I think the potential to use a lot more, in addition to the fact that there is more nicotine in it, is really not to be underemphasized. I think that that's important.
Yeah, and we talked in our last episode with a school board member who the biggest challenge, I think, for them is that it's so easy to hide.
Yeah.
When you smoke nicotine, whether by vaping or by a traditional cigarette, the nicotine travels quickly to the brain, releases the feel-good neurotransmitter dopamine. Dopamine tells the brain, oh, whatever I just did felt good, I'm going to do it again, and trains the brain to repeat the action. It acts as a positive reinforcer. So vaping, especially if you're vaping higher amounts of nicotine, is going to cause higher releases of dopamine. It's probably going to change all the receptors in the brain to increase them. Will create more intense cravings and then lead to addiction in a short period of time.
And I was going to say, so do they build a tolerance? So they do more and more and more? They increase the potency as you talked about?
Yes.
Yeah.
And my question is, we've heard a lot of middle schoolers, and who knows, elementary school students might be vaping. So depending on when they start, I mean, is there a way back? And when you hear in the news that a lot of these young people, teens, have done such damage that they have the lungs of a 70 or 80-year-old, what is the road back? Because our goal is to prevent youth from vaping, but then those who are, help them stop. But then what is the recovery? Do we know? I mean, what concerns me is a 9-year-old or an 8-year-old.
We know that the younger you are when you start using nicotine, the harder it is to stop. But there is always a way back. I think that it's really important to emphasize that there are proven ways to and well-studied ways to help people with addiction. There's treatment, and there are great resources. A health educator can work with you individually. There are medications that can be used to facilitate, and you can work one-on-one with a health coach. It is possible to stop.
What about lung capacity? Can the health of the lungs return?
Yeah, that's it's just too early to say. We'd have to follow these patients over many years and check their pulmonary function tests frequently to see if there is reversal. And it depends on how much their lungs have been damaged from the initial insult. So it's difficult to say.
Let's talk about Kaiser specifically. Can you talk about what has been seen in the Kaiser system? Have there been cases that you can talk about? I'm really curious on just the local impact.
So we've seen a few cases of vaping-associated pulmonary illness. All those patients have been treated and are recovering. So I only do adult medicine, so I work in an adult ICU, but early 20s. Early to mid-20s.
Early adult. When those patients come in, is that generally information that you share kind of I would imagine that you'd have to talk about some of the cases you can learn, but what do you do when those cases come in? Do you report it? Are those reported to the CDC,
Yes.
or how does that work?
So by the time they come to me in the intensive care unit, it is a reportable disease. If you're just vaping, I'm not sure the CDC necessarily collects information on that. Potentially they do. But once the alert was sent out over the summer that people were dying from vaping-associated respiratory illness, it became a reportable disease to the state public health departments, who then sent the information to the CDC. So anyone who came in with severe respiratory failure requiring ventilator support and intensive care essentially needed to be reported.
Do we know if those cases were also ones that had THC, other substances?
Just like the national statistic, the majority of those cases involved vaping THC oil as well.
Okay.
So very much in line with what we're seeing nationally.
When do you see these patients typically?
So from a pulmonary critical care perspective, with regards to the current epidemic, which is severe, potentially fatal respiratory illness, these patients have been seeking treatment probably around 5 to 7 days after exposure. Majority of these cases have involved vaping THC, so not just nicotine.
Right.
And by the time they come in, their typical symptoms are difficulty breathing, cough, chest pain, and other symptoms that are not typically associated with a respiratory illness. So GI problems, nausea, vomiting, abdominal pain. So often, or at least early on, now we're quite alert to the syndrome.
Mm-hmm.
But early on, the symptoms, if the patient presented with a GI complaint or, gastrointestinal complaint, were vaping was not on anyone's radar.
Right.
So diagnoses early on could have been delayed. Now we know that someone who complains of nausea and vomiting and abdominal pain and vaped recently are at risk to decline very rapidly from respiratory-related disease.
So we are learning those things. At least we know
Yeah.
now that these were some other symptoms, so these could be symptoms in this case as well.
Yes. And the median time from vaping to seeking help in the emergency room is about 5 to 7 days.
So they are coming to the ER.
Yes.
I mean, they feel panicked enough where they're going into the ER.
They can't breathe.
What's the reaction in the medical community? I mean, is it just, wow, this just hit so hard so fast? I mean, what is the I mean, what are your guys' thoughts, and then what are you hearing, whether within Kaiser or among peers outside in the medical community?
Oh,
Fear?
it's
Is it fear?
alarming. The moment myself and my colleagues received alerts from the CDC in the summer, we were very attuned to the possibility of seeing more cases. What's especially concerning is how it's affecting our youth. Mm-hmm. We are all concerned that we are at risk of losing another generation to tobacco-causing diseases. After years of successful campaigning against smoking, we are concerned that we are seeing deaths in young patients, adolescents, young adults.
It is such a shame because it did take decades to get to where smoking is really not considered not cool anymore. Mm-hmm. But I just think the electronic part of it makes it cool again for young kids, minors, students.
I think it's really important. Kids need to hear from their parent, and they need to hear from their teacher, and they need to hear from their doctor, because even though they are exploring what do my friends think, what do other people think, if they don't hear it from you, they might be unsure, and you would never want your child to be in a situation where they have to guess what my parent would think, or if my parent knows about this or thinks it's a concern. So I think it's really important as a parent to let your kid know, hey, I've been hearing about this thing, I'm concerned, I want you to be healthy, I'm concerned about you, and to really let the kid know that it's coming from a place of concern and care rather than an angry reaction. Right. Or, at that point, you missed an opportunity. And the best thing is, before it's even started, to make sure that your kid has the information. This is really an unhealthy new thing, and I'm concerned about it. One thing that teens really respond positively, teens like to feel like they're in control. They do not like to be manipulated. And when you say to an adolescent, hey, I can't believe this thing is happening, these companies, these corporations are manipulating us. These same companies that tricked us into smoking now have this new product, and they're so sneaky. They've made this old thing seem new again. They put it in this technology that looks cool to you. They made it smell like candy. They're manipulating us, and selling us that same old junk that they sold us before.
Right, just packaged in a different way.
Yeah, and kids really respond to that because they don't want to be manipulated. They want to feel like they are making their own choices and having their own ideas. They love that independence. So that's a great way as a parent to approach that.
Right. Early.
Early.
Right.
It's also important for parents to pay attention if your child suddenly has a new charger or a new piece of technology that you don't know what it is. I've had so many conversations with parents where they told me, I found this thing in my kid's backpack and I don't know what it is. And the greatest thing, someone told me, I put it in my mouth and it tasted like watermelon. And that was when I knew that this thing that was just, it was just really nondescript. And I thought it was a new charger or some other technology because parents just can't keep up.
Right.
And so just being aware that something like that could be the thing that is going to tip you off. My kid needs help. I need to get in there and help my kid.
Are you hearing from the patient community? Are parents, guardians proactively bringing this issue to try to learn, to try to reach their kids earlier? Are you hearing that?
Absolutely.
Okay. That's
we
good.
hear that in the office every day. And oftentimes parents think, I feel like my kid is not listening to me on this issue. And they will ask you, will you talk about this with my kid? I want my kid to hear this from you.
Right.
I'm going out in the waiting room.
Yes.
Knock yourself out,
Right. Yes.
And it's such a great thing
Yes.
that, parents are asking for help.
So you talked a little bit about Kaiser educating some of the schools. What else is Kaiser doing, or do you think Kaiser and other medical communities can do to help educate, prevent, treat, all those things? I mean, D.A. Schubert is a big believer that it takes all different sectors. I mean, this is a community-wide problem, and there needs to be a community-wide solution.
I think that information is power, and helping people to know, for example, some of the myths, that there's insufficient evidence that e-cigarettes are effective as an aid to smoking cessation. There's just not evidence to support that there are proper methods of helping someone with smoking cessation, and that we have those resources. We want to help you stop smoking. If you smoke, tell us you want to stop and we can help you. I think dispelling that myth is important. I think addressing access is important too. I think that it's not a coincidence that across the street from the high school is an orthodontist office and a vape shop. They are selling vape to kids. Why else would they be across the street from the high school? As parents, we should be doing something about that. We should be asking that strip mall, why are you renting this space across the street to the vape shop? You have an obligation to the community you serve to care about our public health. This is a public health problem that affects our children. We want you to help us not have our kids coming across the street after school and buying this stuff. If we all write a letter to the strip mall owner, maybe we influence that they rent that space to them. In 2016, there was the Child Nicotine Poisoning Prevention Act, and some things that were already in place for cigarettes got addressed. For example, vapes shouldn't be given out as free samples at concerts. That was happening. Also, they shouldn't be sold in vending machines. So we made a tiny bit of progress with that, but not enough progress. The cigarettes are not allowed to be advertised in the way that vapes are getting around that by packaging it as something else and calling it something else, even though it's that same old junk. They're able to put their advertisements on social media and music download services, things that kids access. And they're there for the same reason that their product smells like candy. they're trying to market to kids. And they're successful. They're not only successful in poisoning our teens, they're poisoning toddlers. You might be interested to know that the toxicology service, the phone calls for advice from poison control for children 0 to 5, 50% of those phone calls have been about exposure to vape juice. A toddler is drinking the vape juice or they got it on their skin, and the parent wants to know what to do. And now we're talking about something that's in your adolescent's backpack because it's mostly teenagers and young adults who are using this, mostly. And that's not a child-proof place. So your toddler finds that in his big brother's backpack and he eats it. So, or he gets it on his skin or whatever he's doing. So those exposures happen. Plus, these things are a fire risk. You know, you have this thing that heats up in your kid's backpack, which is full of crunched up paper. There's so much danger here, besides the obvious danger that we came here to talk about, that it's causing respiratory disease. It's also poisoning toddlers. It's also starting fires. I mean, the public health implications of this, there's nothing positive to say.
Right.
And there's another issue here, and that's that there's very little, if any, FDA oversight or regulation on how these devices are produced or even the liquids, what they're containing. We don't know what is in the liquids themselves, what contaminants are in there. Of course, if you buy something on the black market, that's one thing. But the vaping products that are sold legally, who's looking at them? Who's testing them? How do we know what's in them?
So in 2016, the same year that they passed that Child Nicotine Poisoning Prevention Act, there was also something passed that was called the FDA Deeming Rule. And the purpose of the FDA Deeming Rule was to extend the FDA's regulatory authority to include all tobacco products, including e-cigarettes. But unfortunately, in 2017, the very next year, the FDA decided that they were going to delay implementation of the deeming rule, that they didn't have the staffing and the resources to do their job. And so they said that all e-cigarettes that were already on the market could stay on the market without any pre-market review until 2022. And now it's just so far progressed with all these products having all this lead time to get into our communities and to get kids already hooked on them. I was talking with one of our Kaiser Health educators the other day, and she was telling me a little bit about how expensive vaping is. And she said that eventually, as kids become addicted to nicotine, it's very likely that they will become smokers of regular cigarettes.
Yes. It's cheaper?
They're cheaper.
Yes. Yeah. And they're hooked on the nicotine, so at that point, it's not the coolness.
And they need the nicotine. Absolutely.
Well, there are numbers to even show it. They found that a year after people were smoking, started smoking e-cigarettes, about 70 to 90% of them were also smoking regular cigarettes.
So it's the exact opposite of what they marketed. They marketed it as a way to get off of it, and really, it's a way to get new people on it.
It's not just about nicotine either. No, e-cigarette solutions, besides sometimes being adulterated with psychoactive substances like marijuana, just regular e-cigarette solutions that haven't been adulterated in that way have aldehydes, they have nitrosamines, they have metals, as she was talking about, they have tobacco alkaloids and polycyclic aromatic hydrocarbons. I have, in my reading, seen that there's been some discussion about fine and ultrafine particles in the vaping inhalant, and it may be that these tiny particles are able to deliver carcinogens more effectively in your bloodstream than regular cigarette smoke. That's been hypothesized in the literature, so it may actually, in time, become clear that it's actually worse for you.
Right, more addictive.
You know, when people smoke with a vape device, the solution is vegetable glycerin or
I think it's propylene glycol.
Propylene glycol,
yes, which is is a food additive.
Is that the base of
that's the base that dissolves
it's like
the nicotine?
Glycerol.
Yes.
Yeah, and people say that if you vape in a closed car, After you vape, the windows are sticky. Can you imagine what is happening on the inside of a child's lung? This sticky solution. When I think about all the research and development that goes into choosing new drugs that a respiratory therapist might administer in a situation of anesthesia for surgery or to make you comfortable when you're in the ICU, we're so careful about what we put on those delicate tissues, the inside of a child's lung, that to me, putting, vegetable glycerin or propylene glycol, glycerol inside of your lung is just unfathomable. And the American Academy of Pediatrics, in their policy statement, which they just renewed this year in January, a new version of their policy statement, they talked about that, and that when you are around a person who is vaping, you can be exposed to polycyclic aromatic hydrocarbons as well as nicotine, volatile organic compounds, fine and ultrafine particles, metal and silicate products at higher levels than with conventional cigarettes, and also just generally the exposure to an adult doing this is probably also sending a message to the child that it's something to do. So, I think that children should be entitled to an environment that's free of smoke and also an environment that's free of vape.
I'm curious, all this research and the information that you presented, is that all fairly new? Because why wasn't this all brought to people's attention before we got to the point where we are now? Or is this things that have just been learned?
It's fairly new. The epidemic seems to have started around April.
Okay.
Which is outside of flu season. And the reason it came to such attention so quickly was that patients were becoming so critically ill and some of them were dying. Right. And that's when it unleashed a series of investigations. Okay. The public health department was alerted.
Studies and things, yeah.
So we're only finding out about the pathophysiology, and we still don't know what the culprit is now.
It's hard to study something in a scientific way when that thing is not always the same thing.
Right.
When we do research, we study one variable at a time.
It's controlled, right.
But when you have something that's unregulated and you don't know what's in it and you don't know where your child got it, we're doing a forensic analysis. Yes. We're not doing a research study.
Yes.
And so the potential for there to be many factors, all of which are harmful. The bottom line message is don't vape. Just don't vape. And if you vape, stop. Let us help you.
Right.
We can.
Right. Are you optimistic about information that is getting out there? I feel like the pressure is starting to be on in terms of the companies.
I think it's a little too early to tell. I'll let you know next year. It'll depend on how many more cases of the respiratory illness I see. I think a lot of it hinges on how people absorb the message. Are the youth of today and adolescents of today listening to what's out there? Are they paying attention? Are they concerned about their own well-being enough and the potential consequences to stop this habit? I'm also concerned about the ability to switch out nicotine or the liquid for anything else, such as illicit drug use. So
more than THC.
One of the things that makes vaping so dangerous is the ease in which you can substitute the substance for something else.
Right.
And we've seen it in THC substitutions. There are other substances that are now being vaped. A lot of it is underreported because a lot of it is probably illicit.
Right.
But we're seeing synthetic marijuana being vaped now. So the THC portion is not detectable. We're seeing stimulants close to cocaine and meth that are now being vaped. So it's a slippery slope. As long as you have this product on the market and as long as you have curiosity and as long as you have people selling unregulated liquids on the street,
right,
we have no idea what we're going to be seeing in the future. We're still trying to determine what the offending agent is that's causing these respiratory illnesses. We're still trying to understand the pathophysiologic processes of the lung injury, although now we're starting to learn that the inhalation of these products causes chemical burns in the airways and the lungs, similar to toxic spills of the past. industrial, waste bins that spill. And
So
then
that's not the smoke, it's the chemicals.
the chemicals. That's what they're finding in the airways, and then and the lung damage. It appears to be chemical inhalations resulting in chemical burns. It's severe.
Yeah.
And serious, so don't vape.
Well, thank you guys so much. I mean, it's very interesting to hear from the medical perspective and from a system as big as Kaiser to know what you guys are doing on this front. So very much appreciate it. Thank you so much.
Thank you for having us.
Thanks for inviting us.
Thank you for listening, and I hope you enjoyed this episode. You can find all of the Justice Journal podcasts on our website at sacda.org, iTunes, Google Play, and YouTube.